For those of you who don't know me, my name is Christina Hildebrand, and I am the founder and president of A Voice for Choice Advocacy. We educate and advocate for informed choice and transparency of what goes into your body, be it food, air, water, pharmaceuticals. We want you to know what's in it, and you get to choose whether you put it in it. The way these Q&As work is that I will take any question as long as it pertains to our mission, and I will try and get through all of them. If you do have a question, please put it in the Q&A below, and I will get started. So the first question that we have is, there appears to be a recent proposal to ban air travel for unvaccinated in California. Of course, anything can happen these days, but could this bill get passed? And if so, how soon could it happen? Does the bill include travel by road also? So I haven't seen this proposal. And so it's interesting because I don't think it can really be implemented easily. Let's put it that way. If you are coming into the United States and you're a foreign person, not a green card holder or a citizen, then you have to show vaccination status. So coming in internationally, I think it can be. If you are a US citizen and a US green card holder, they can't ban you from coming into the country that you live in, regardless of whether you're vaccinated or not. And so I think this would be really hard for California to implement. Could they do it? They probably could, but I just think there's going to be a lot of pushback, and they would I think, to me, if it's going through the legislature, which is where it should go through, or although Newsome, has free reign right now still, if it goes through the legislature, I think there will be pushback from the tourism lobby, from the airline industry, from a lot of different areas. And so I think it would be hard to implement. I think really we'd have to see what the bill actually says, or what the legislation actually says. The other question is, would they have religious exemptions, medical exemptions? What kind of exemptions would they have? If this is your home, I would think it's similar to the US, where they can't really stop you from coming into your home without being vaccinated. I think there would be a lot of lawsuits, let's put it that way. So I think we would have to see. Okay, next question. Under HIPAA, is my employer allowed to request my vaccination status? So HIPAA specifically is a privacy act between you and your doctor. All it says is that your doctor cannot release your medical records to anyone without your consent. So HIPAA doesn't apply here at all. As to whether your employer is allowed to request your vaccination status, yes, they are, especially if they're a private employer, or if there's a federal mandate stating that they should, or a state mandate stating that they should. So can they do it? Yes, they can. I should say you can contest that there are medical privacy laws, but the key piece is if they're asking you for it, you can be told to give it to them, and it's what they do after that. It's to keep the medical privacy is for them not to share it with anyone else. Okay, next question. My employer is requiring a booster, but I just recovered from COVID. They are not accepting religious or medical exemptions. However, is there anything I can do to avoid getting the booster? So your employer has to accept religious and medical exemptions. Now, they have to at least offer them. Whether they deny you afterwards, either the exemption or the accommodation, that's another story. I think this COVID immunity is going to start becoming, now that they've gotten through most of the vaccines that they've purchased, I think natural immunity is going to become more prevalent. So for example, there was an athletics, and the NCAA just announced that they are allowing natural immunity for 90 days to be counted as fully vaccinated. I would go back to, first step, I would go back to your employer and say, I'd like to submit a religious exemption or a medical exemption, and see what they have to say, because they really can't deny you that. That's in, if they do that, that goes against the Civil Rights Act. Okay, next question. How many times are you able to appeal a religious exemption that has been denied? Usually you can only appeal it once. So usually you have one shot at appealing it and changing their mind. that you have something else to say. What is your best guess of the possibility that California will pass a law to remove religious and personal belief exemptions for COVID? If so, how long do you think it takes until it becomes mandated in the UCs and Cal State schools? Thank you. So the only place where they would remove a religious exemption or personal belief exemption would be for K through 12 schools. So K through 12 schools currently, for the most part, don't have a COVID vaccine requirement. And in San Diego, it was struck down. In LA, USD, they postponed it. Culver City, they've also pretty much postponed it. They're saying they're not implementing it. And so there are some. Oakland, Piedmont are still standing, but I think they will fall too. So what will happen, and what the governor has said will happen, is that there will be a vaccine requirement as soon as the FDA approves the vaccine for certain age groups. So my best guess is that the 12-plus-year-olds, the FDA will approve that vaccine in February or March. Once that happens, the CDPH will put in a regulation that requires the COVID vaccine, but in order for them to do that, there'll be a personal belief exemption. And then that same thing will happen, and it will go into effect in July or September, the next school year, and you'll have a personal belief exemption. The K through 6th grade, my guess is that'll be approved fully, probably the summer, maybe early fall, but probably the summer, in which case it'll go into effect the same time. So for the 2022-23 school year, we will see the COVID vaccine with a personal belief exemption at least until January. Once this legislative session, once we see what bills have come forward, there is very likely a bill that will remove the personal belief exemption for school children. And if that gets to the governor's desk with that intact, then there will be no personal belief exemption from January 2023. Now, they may implement it in January 2023, or they may implement it in July of 2023 for the following school year. We don't know what will happen there. Now, the UCs and the Cal States, they have offered a religious exemption for the COVID vaccine and for the flu vaccine. Actually, they haven't required the flu vaccine this year. They've just required the COVID vaccine. I don't see them removing the religious exemption for the COVID vaccine for this school year, and possibly not the next school year, but they could remove it. They're not under legislation. They are, considered, they're public schools, but they're considered, they have their own governance. And so they can do whatever they want when they want to. So they could remove the religious exemption tomorrow if they wanted to. I don't think they will, but they could. Okay, next question. Can Newsome use emergency powers at a state level to go around any federal Supreme Court decisions? So yes, if you're talking about the vaccine mandates, for example, the reason why the Supreme Court is saying that they're not valid is because Biden and OSHA and whatever other entities created these federal level vaccine mandates. And the courts are saying that those entities and the federal government and Biden don't have the power to do that. Does Newsome have the power to do that? Yes, absolutely. I think he will be taken to court over it, but on a state level, that's where the vaccine requirements lie. So could he do it? But my guess is he's not going to do it. My guess is he is going to leave it to the legislature, because once his emergency power, once he finally takes himself out of a state of emergency, which who knows when that'll be, but once the state of emergency goes away, all of those orders that he had fall apart. They don't exist anymore. So anything that he put in place under emergency powers goes away. And so he wants to have something that is more long lasting than that. And so he'll put it through the legislature. And I could see the legislature requiring that or trying to make that happen. Okay, next question. our school is requiring N95 or KN95 and mandating those. Is there any way to avoid the N95s? Are there any masks available that look like N95s but are not and are comparatively breathable? Just a mention that we have already struggled with school because of the MA and you're using saliva tests instead of the school provided nasal swab testing. So I am glad you brought this up. I have fallen into this category this week with both my kids to some extent. And yes, there are, especially in the San Francisco Bay Area, there are many, many schools that are requiring N95s or KN95s or surgical masks underneath a cloth mask. I have looked high and low for N95s that look like, or a mask that looks like an N95 that would pass by for an N95 that is breathable. I have not found a single one. If anyone finds one, please email me, because there are many parents in the Bay Area that are in this situation. My recommendation is to definitely complain to your school. I sent a letter from a Voice for Choice Advocacy. I sent a letter to both the Santa Clara Health Department, which is where the schools were told by them, they were recommended by them to have N95s for the kids. So I wrote them a letter, and I wrote Dr. Ghali, the HHS director, an email, and many people in CDPH, asking them, because Dr. Ghali actually said that they would not be required of anyone, including school children. And so if he's saying they're not being required, but then schools are requiring them, it becomes, it's a contradictory statement. And so I have requested that, plus if they are saying that they recommend them, where the science is that these are okay for kids to wear for 10 hours a day, because, pre-COVID, you had to be fit tested and you had to have a medical exam in order to wear an N95 mask. And you were told to wear it as little as possible, not as much as possible. The one thing that I will say from my kids, if you put one on and you don't push in the piece that goes over your nose, if you just kind of hold that, have it sitting out as much as possible, it at least gives some, breathing space. And I don't think schools are checking that as much. But it is awful. We are putting, Voice for Choice Advocacy is putting a flyer together to try and counter that. But I think, I would also ask your schools, what is the metric for going back to regular mask wearing? And what happens if your child doesn't wear one of these masks? So for my kids, one of my kids, if you don't show up with one of those masks at the gate, you're given an N95 and told to put it on, and you are not allowed to be in school if you don't have one on. So it's not a, there's no way of getting around it. I do think the N95, if you're double masking, my personal, and this is no scientific proof, but my personal feeling is that an N95 mask, if you open up the nasal pieces, that is better than wearing two masks, wearing the surgical mask with another piece. But I worry about not only the breathability of it, but also the chemicals in those masks. The other thing is the CDC says that 60 or 70% of KN95 masks and N95 masks and KF95 masks are counterfeit and therefore don't have that breathability. But I wish somebody would make a mask that looked like a N95 mask but was breathable, but I haven't found one yet. Okay. Christina, please let us know what urgent do items are sneaky legislation attempts currently on their way in Sacramento. Will you send out a newsletter to let us know, please? So the biggest thing that you can be doing right now is to meet with your legislators, meet with their staff. So find out who your legislators are and go and meet with them, and go and meet with the staff in district or over Zoom and just express your concern about this legislation. I think the biggest thing for me, and it's a change from the last time I did one of these, so pre-Christmas, our perspective was for any of these vaccine mandates was to request a religious exemption, a conscious belief exemption, and to have natural immunity identified. However, because Omicron is so prevalent among the vaccinated, and it's really, I know of many vaccinated people that have gotten COVID in the last month, and very few unvaccinated people that have gotten it. Doesn't mean to say I don't know of unvaccinated people, but just the ratio of vaccinated people to unvaccinated people shows that there are more vaccinated people. But I would say that to me means that, what is the point of vaccine mandates? What is the point of vaccine passports or requiring a vaccine to go in anywhere? Because the vaccinated are transmitting this, the vaccinated are catching it. So what is the point of requiring something that does nothing, basically? And I would use, I more and more as I think about it, with Omicron, that narrative is where we should go. I also think for the K through 12 children, why do we need it in the legislature? CDPH can put it in place with a personal belief exemption. We have no idea what COVID is going to do in the next month, let alone the next 3 months, 6 months, 9 months, 12 months. And so to me, adding a disease to the list of requirements that vaccines are required for school doesn't make sense at this point, because we just have no idea what's going to happen. It may peter out completely. It may get worse. It may do whatever. I think the other place, if you're going to go talk, so my big thing with legislatures is if you haven't talked to them before, we're getting close, so you're going to have to talk vaccines pretty quickly. But what you really need to do, I recommend going and watching, if you go to our YouTube channel, which is YouTube and then A Voice for Choice, the most recent video on there is me explaining how you go talk to your legislators. And I would watch that if you haven't, or if you don't know how to talk to your legislators. But you really need to find common ground with your legislators. So work out what they're passionate about, and with their staff too, but work out what they're passionate about and go in and talk about those things before you talk about vaccines. But we're getting to a point where we're going to have to talk vaccines soon, because there will be bills showing up. But right now, it's going and talking to your legislators about whatever they are interested in. And you can pretty quickly work out what they're interested in just by going to their website. And I go through how to do that in that video. The other place that I would definitely show up at is your school board and your board of supervisors, doing the same thing, commenting on things like these N95 masks, commenting on the requirements for vaccines in your city, in your town, et cetera, et cetera. Okay, next question. With the decision from the Fifth Circuit Court, how does this affect the mandate for vaccination? So as I said, anything that happens on a federal level, I think all of these federal level vaccine mandates will be struck down. And they will be struck down because it's up to the state to make those requirements or those, legal statute legislative decisions. And so to me, it just means that California is going to do that themselves. And I've said this all along, I think there will be a bill that requires employers to get to have their employees vaccinated. Again, the same logic because before applies, what's the point with Omicron that everyone's getting vaccinated is getting Omicron, or getting COVID. But I think California is the one state that will implement that from a legislative perspective. And they can do that. Okay. My religious exemption for community college was denied today. My college stated that they are denying all exemption requests due to a rise in cases. Are there any options to appeal? So exemptions don't work that way, right? You either have a religious exemption or you don't. And you can't deny an exemption. What they're saying is they're denying your request for a religious exemption. Well, they can't really do that because your religion doesn't go away. It doesn't come and go. It is there. What they should have done is really, and they may have done this, you may just not have written it this way. They should accept your religious exemption, but deny the accommodation, which means that they deny you being able to go on campus. The rise in cases makes no sense. It makes no sense when the vaccinated are also that part of that rise in cases. So pre-Omicron, even pre-Delta, when the vaccination seemed to be working and seemed to be allowing people who are vaccinated to not get the disease and seem to not transmit the disease, it was a different story. But now that Omicron is spreading among the vaccinated, my response back I would definitely appeal it. And I would write to them something along the lines of the fact that the vaccinated are also part of those cases, and that you being unvaccinated serve no greater risk to transmission or to getting COVID than anyone who is vaccinated. And I would try and frame it in that way and see what they have to say, and ask them to prove that you are a higher risk if you're masked, if you're testing, say whatever you're willing to do, that you are a higher risk than somebody who is vaccinated and doesn't have an exemption. Okay, can an employer force online employees to get the vaccination? Yes, it's insane, but yes, they can. One of the Biden mandates would have required that. It doesn't make any sense. It's part of what the accommodation is. If you were to, what I would do is submit a religious exemption. And if you are denied, they have to prove that you are an undue burden, they have to deny your accommodation, saying that working from home would place an undue hardship on them, on the company. And there's really nothing they can say that makes you an undue hardship if you've been working from home for the last 18 months and you don't have to go into the office or you don't have to travel. Are you aware of any efforts which have successfully shut down mandates in school districts in California? So yes, so San Diego Unified, there was a lawsuit that they won. And so in San Diego Unified, there was a mandate and there is no longer a mandate. LAUSD had a different set of lawyers. Their briefs were much longer and much more scientifically oriented. I really liked the San Diego Unified brief. It was very short, very to the point, and basically said that the school district had no jurisdiction to be able to mandate the vaccine. And it was short and sweet, and they won it. And it's probably going to be appealed, but they won it, and there is a stay right now on that because of that. I think there are other lawsuits coming in other school districts, and I hope those lawyers use I think some of the same lawyers are doing some of those. I hope the other lawyers really use those briefs, because you don't want to argue the science in a brief. You really want to keep it to the law. I also think that they are going to have private schools there are going to be lawsuits against private schools that are requiring the vaccine. Okay, nice lady at my dentist office asked me for vaccination status. I was there for a routine cleaning. Can they ask me this? No more privacy. They can ask you it. You don't have to answer it, but they may deny you service. Basically, because they are a private organization, they can have whatever policies they want to have. And it isn't medical privacy at that point, because they're asking you. You can refuse to give them that information. And so you can say, I don't share my medical information with people. I think it's crazy the amount of information that we ask. I mean, my answer back to people like that, honestly, is, oh, do you want to know if I'm HIV positive too? Or do you want to know if I have, some sexually transmitted disease? And I laugh about it, but when you ask them that, then they're just like, oh, no. Now, from a dentist office, my guess is she's just doing her job. I would have said, I'm not willing to share my medical information. Now, most likely then they're going to assume you're unvaccinated. I wish more vaccinated people would be concerned about medical privacy, but in this day and age, it seems to have gone out the window. Okay. If they remove the religious personal belief exemption, are there still actions that could follow to prevent mandatory vaccines? So as I said, they cannot remove the religious exemption from employment, because that's in the Civil Rights Act. If they remove religious personal belief exemptions for K through 12, I think it will be incredibly hard, because especially because we're in California, and this has been litigated before. We litigated this with SB 277, and our Voice for Choice Advocacy had one of the lawsuits, and California is an incredibly biased place, and it is really in the court system, and they very much believe in public health. and they very much believe in the greater good. And so when you're arguing in the California courts, it's unlikely to win. Now, I do think there will be an argument for religious exemptions, and we are looking into a lawsuit to do that for K through 12 if we get to that point. And I think that, our lawsuit in 2016, we didn't take it to the Supreme Court because of the makeup of the Supreme Court at that time. I think if it had happened now, we would have probably taken it to the Supreme Court and had a decent shot at it. Okay, there is a bill on the docket in Washington state to forcibly remove unvaccinated families to internment camps. Is this in force anywhere else in the US? And what is your opinion of how to proceed? So yes, I saw that just recently. First of all, God help us, if Washington actually passes that, wow. I think there are lawsuits, huge lawsuits that will happen if that does happen. I also think, and I think they would have a chance of winning because the vaccinated are also transmitting disease and are getting sick. And so I think it's a lawsuit waiting to happen. If it passes, wow, Washington's even more lost than California. But, nothing surprises me these days in some of these states. Okay. I'm going to try and summarize it here. So somebody went to high school at Woodside Prairie, attends UCSB on a full scholarship for women's basketball, didn't want to, but felt forced to get the COVID shot, received the J&J in June of 2021. Her logic was that she didn't read the J&J was closer to technology to routine vaccines. Now she's being mandated to get the booster to comply with the NCAA rules in order to play basketball. She has until January 31st to comply. Now that the jabs have been on the market for a little over a year, we have data confirming side effects, myocarditis, etc. Her father has a history of myocarditis, so she has genetic predisposition. She doesn't want to take the booster, knowing what we know now. In addition, we don't believe she has an option of getting a J&J booster. She does have an option of getting a J&J booster. It's not recommended, but you can definitely. I was in a pharmacy today, and they were giving J&J boosters on certain days. It's harder to get them, but you can. And even if she could, she would still not knowing what she does now. And the premise she originally got vaccinated under, we know now, is a lie. The vaccine doesn't stop transmission. The CDC changed the definition. What is her best angle to get a religious exemption for the booster and any subsequent boosters that may be on the horizon detailed? So it is really hard. And I would recommend that she joins one of my religious exemption writing workshops because I go into this. It is hard to get a religious exemption after you have taken a vaccine. However, it can be done. So the key piece is that your religious beliefs have changed, or you didn't know something about the vaccine. So for example, that you didn't know what the ingredients were, that it included, that they've been tested or manufactured with aborted fetal cell lines, things like that. I don't know with a religious exemption. The first thing I would do is find out with a religious exemption if she can actually play still, because there are some schools that have said, and there was a lawsuit that was won in Michigan, Western Michigan University, where athletes were not allowed to play if they had a religious exemption. And there was a lawsuit that was won, but it may not be the case for her sport or her university. So I would just find that out, and because you may be up for a lawsuit at that point. I do think if she wants to apply for a religious exemption, my answer is to go to our religious exemption workshops and write one from that perspective. Okay, next question. I'm a teacher, and could you go over Newsome's rule about vaccine mandates for teachers? I'm assuming that doing a religious objection in a school district can be denied if you're put on permanent administrative unpaid leave. Is that the norm, and do you think that will be for all school districts? So currently, if you're a teacher, you have to, in most school districts, there are some school districts like LAUSD where they have mandated the vaccine. But if you go with just what's out there for Newsome, and what the order says for teachers right now, it is that you're either you have to share your vaccine status. You have to show that you're vaccinated, or you have to test. There is no religious exemption in there because you can do one or the other. And you're not going to get a religious exemption against testing. If you have a requirement, or what Newsome has said is when the requirement comes in for school children, that's when it will kick in for a vaccine requirement, will kick in for teachers as well. So when CDPH puts the regulation in for school children, he will also put a regulation in for teachers that they have to be vaccinated. At that point, you will have to be offered a religious exemption or a personal belief exemption. So he seemed to imply that a personal belief exemption would be allowed for teachers too. I'm not sure that they will do that. If you have a religious exemption, they can put you on, well, so they're not supposed to put you on unpaid leave of absence, but if I take LAUSD, for example, what they did is they shunted all their teachers over to the City of Angels, which is the independent learning school, online virtual academy. So all of the unvaccinated teachers are over there. All of the ground staff and people, but Newsome didn't mention those people, but all the ground staff and other people that are not teachers were basically allowed to use their holiday or their vacation pay, sick pay, and then were put on unpaid leave of absence. Can they put you on unpaid leave of absence? They can. The key there is that they have to show that you are causing an undue burden by being in school without being vaccinated. And again, my perspective is with Omicron and the vaccinated transmitting and getting it, it puts you on an even keel with a vaccinated teacher. So I don't think they can do that. Is it going to require lawsuits? I do think it will require lawsuits, yes. Has SCOTUS made a decision on the Biden OSHA mandate as of this afternoon? No. I think they will. I think it goes into effect tomorrow. So I think my guess is that they will do it before tomorrow, but they haven't as of now, as far as I know. Okay, I am looking for laws to support me in my argument with my school district, my employer, who is discriminating against non-vax by forcing them to quarantine at home for several days and use their own sick time if the district deems they've been exposed, even though they have no symptoms and a negative test. It's sheer discrimination. So my guess is they're using the requirements that were put out by the CDC and by CDPH. And it is that, they're just following the rules or following the guidelines that are there. Now, the recent change from the CDC to 5 days, 5 days in a negative test, is for everyone, is for vaccinated and unvaccinated. So if they are, but yes, they have the right to do that, and they will say they're following guidelines. But the vaccinated should be doing that too, I believe. I believe if they're, oh no, it's not. If they're a close contact, then they don't have to. But yes, that's not your school, that's the CDC, unfortunately. Okay, for the 5 upcoming bills to be watched regarding mandating HPV for high school passports, etc., can you provide specific bill numbers? I cannot, because they haven't been put into the legislative record yet. So they haven't been made into bills. We know about them because of our lobbyists. And so we have spoken to different legislatures and legislative offices, and we know that they're coming. For those people who aren't aware of the 5 bills, the 5 bills that we anticipate are a K through 12 COVID vaccine requirement without the personal belief exemption. So it'll be required, and the only thing you'll be able to get is a medical exemption, which are impossible to get. A societal mandate, so requiring people to show vaccine passports or vaccine cards in order to get into certain places, which has been done in San Francisco and LA and Oakland, Sacramento, different places where you basically have to show your vaccine card in order to get into a gym, into a restaurant, into whatever else. The next one that we anticipate is the codifying what Biden tried to do, which is making employers require their employees to be vaccinated. The other one that we know of is the HPV vaccine and the meningitis vaccine. So it's not just HPV, but the requirement for the HPV vaccine and the meningitis vaccine for high school. And then the last one, which is probably the most the one that we have least information on and we don't have confirmed is the requirement that 12-year-olds and up can consent to any vaccine. So in California right now, a 12-year-old can consent to the HPV vaccine and the hepatitis B vaccine because those are sexually transmitted diseases. And then they can also consent without their parents knowing to treatment of sexually transmitted diseases and abortions. So that's already in statute. So it's basically expanding that to include all vaccines. Okay, my 7th grade son was granted an ME from his pediatrician, submitted in the CARE ME system in April 2021. Received an email 12:30 from CDPH stating the ME was revoked and I have 30 days to appeal. An appeal process involves uploading medical documentation of up to 10 documents onto the CARE website, which are then reviewed by a panel of 3 physicians. He was granted the ME based on a family history of severe adverse vaccine reactions. His older sister suffered seizures post-childhood vaccine. His grandmother lost the ability to walk following the Prevnar 13 vaccine as an adult. He has multiple drug, food, environmental allergies, and neurological side effects from antihistamine medication and requires an EpiPen due to severe peanut allergy. I am in need of advice on how to go about filing a very strong appeal so my son can keep his medical exemption. Would legal counsel be helpful? So one thing that I have learned in the last year, where there are not that many doctors that are uploading medical exemptions to the CARE ME system, although we did a Public Records Act request, and there was in the thousands. It was more than I anticipated, more than I thought they were going to be. But what we have found is that a lot of them are being revoked. So you put it into the system, the doctor puts it into the system, and the assumption is that, you know, they only were supposed to review them if the doctor had more than 5 of them, or if your school was under a 95% vaccine requirement, which very few schools at this point are. However, what we have found is that most medical exemptions that are put into the CARE ME system are revoked. They're not even questioned, they're just revoked. And you do have 30 days to appeal. The key piece here, what we found, and I will say, I haven't had too much success, or I haven't seen too much success on getting them reinstated. But the key thing is for the doctor to write all of the information and all of the documentation. Getting a lawyer doesn't really help because there's nothing that you can do. It's only submitting the information. Now, the key piece here is what they're basing it on is that what you wrote is not standard of care. If he has not had a reaction to that specific vaccine, if it doesn't follow under the ACIP guidelines or the CDC contraindications and precautions, then they're not going to grant the medical exemption, unfortunately. Like things like family history doesn't count. And it should, by all means it should. But what we're seeing is that it doesn't. Now, that doesn't mean to say that I don't think you should appeal. I absolutely think you should appeal. And it's up to your doctor to write a strong, convincing argument. But you have to know that they're going to base it on standard of care. And standard of care is none of the things that you mentioned, unfortunately. It is literally, if you go to the contraindications and precautions for a vaccine, it is that you've nearly died from that one vaccine. And then, you know, and that there is documentation of that, which usually there isn't. So unfortunately, we're in a place where the medical exemptions in California just aren't even being accepted in at all. Okay, can you help confirm the hepatitis B requirement for 7th grade and above? I understand that it is not required when entering 7th grade, but what about 9th grade? So the hepatitis is correct. The hepatitis B vaccine is not required. It's specifically in the statute. It just says it's not required for 7th grade entry. However, it doesn't say anything about any other grades, and the hepatitis B vaccine is required for school entry. So for schools that check the vaccines in 8th grade or 9th grade, or if you're transferring, you know, to a new school, a new high school, and they check it, then it is required if they choose to require it, type of thing. So, there are schools that don't check. There are high schools that are independent, standalone high schools that don't check vaccine requirements at incoming, because they just assume whatever you had at 7th grade, you're good with the rest of the, with what you're doing at 9th grade. So yeah, so it is required, and they can, if you are at 9th grade and they're saying you need it, you do need it. I work for a hospital that already received 2 doses of the Pfizer vaccine and wish not to receive the booster. Can I still write an exemption letter and have it approved? The due date for all doctors and nurses to get the booster is February 1st. Do I still have time to send a letter in for an exemption? So I spoke to that. I think the answer is take my religious exemption workshop. I do think that these people like you that were forced to take, or that chose to take, the first initial shot, it is hard. It would have been better if you had resisted and written a religious exemption initially. I think there are a lot of people, and I wish you would find, I hope that you find the other people who are in the same situation as you, because I think there needs to be resistance. They need to lose more people, or have the threat of losing more people. I mean, what I have been reading, and I've been talking to people who are nurses and doctors in hospitals, is that, so much of the overwhelming and the surge in hospital beds and the lack of hospital beds and that kind of thing is partly because of the lack of staff, and that there is a huge shortage. And, similar to what the airline industry did, I think if the people walked out saying they don't want to receive the booster, I think they would listen. I think they would have listened initially too, but we saw in Texas, the Methodist hospital, I mean, they fired 120 people. So clearly there was not much listening going on at that time. But I think at this time, especially, as I said, with the Omicron variant, with people getting COVID, I mean, they're in San Francisco, London Breed, the mayor, put out a statement of how many firefighters, police officers, and what's the other one? Paramedics were missing off the shift in the last day because of COVID, because they actually had COVID. And so to me, this is when you push back, is there a way that you can find all the other people in your hospital that don't want to get the booster either, or that have had COVID, that got COVID, and that don't want the booster for that reason, for whatever reason it is. For San Mateo College, I need to do tests twice a week on campus. Can I ask them to do my own testing, saliva or nose test? Yes, you should be able to. So I would definitely ask. At any point, if you're required to do testing, most places will say, sure, you can go do your own testing. You may have to pay for it yourself, but for the most part, yes, you can request it. We do have a site on our Voice for Choice advocacy that is COVID-19 testing. So if you go to voiceforchoiceadvocacy.org, COVID-19 testing, and that has information about the COVID testing and what you want to ask for. Okay, my company has approved my religious exemption, but they cannot accommodate me due to my leadership position. Their position is that the belief that the leadership role is defined by getting vaccinated. I believe I'm exemplifying leadership by not being fearful to return to work as a vaccine-free employee. What ideas do you have to combat this situation? Wow. Okay. It shouldn't have anything to do, your medical status and whether you have the vaccine or not should not have anything to do with your role. So, for me, I think there's a fundamental issue with the premise there. And do you really want to be working for this company? If that's their position, if that's their perspective, I think it's bizarre. I'll just be completely honest, but the world is a bizarre place right now. So I don't think you're going to get anywhere by arguing what they believe a leadership position is and what they don't believe a leadership position is. I think they have it in their minds clearly that this is what it is, and they're clearly COVID fearful. They're clearly, on that side of things. I would argue more that the accommodation, they have to prove undue hardship in order for them not to accommodate you with a religious exemption. Undue hardship is not defined by what their belief of a leadership role is. That's not undue hardship. They can't tell you that you are putting them at a financial burden or a public health safety risk because you're in a leadership role. It just doesn't make any sense. So I would respond to them arguing the religious exemption and the religious accommodation and undue hardship, and that they have to prove that you are an undue hardship, that you're a burden on them, either financially or health safety wise, for them to not allow an accommodation. Okay, what does the age 12 plus consent, if passed, apply to? Just vaccines? We don't know. We haven't seen the document wording, so we haven't seen the bill wording. If you look at what San Francisco passed, so San Francisco put this in place probably now a year ago, maybe 9 months ago. They put in place an order saying that 12-year-olds could consent to the vaccine, that they had to try all their best to reach the parent, but if they couldn't reach the parent, then the child could consent. So we don't know what the language would be. We haven't seen a bill for it, so we don't know at this point. If I'm planning to work in someone's home, do they have the right to ask my vaccination status? Do they have the right? Yeah. Do you have to answer them? No. Does it mean you may not get the job? Yes. So they can ask you any question they shouldn't really. I mean, they're not supposed to ask you things that would be discriminatory. And here in California, our Civil Rights Act includes medical condition and genetics. So you could say, I don't believe you are allowed to ask me that per the Civil Rights Act, because you would be discriminating me. For example, you can't ask me if I'm pregnant or not when you're hiring me. But if you don't answer, do they need to hire you? No, they don't. So, I mean, I think you come out equal, because if you say that, they'll probably say, okay, well, we're not going to hire you. We found somebody else that we're going to hire. So, unfortunately, if you can prove that they didn't hire you because of those reasons, then you have a lawsuit on you that you can file, but you have to be able to show that they didn't hire you because of those reasons. Okay, next question. Are you surprised that the age 12 through 15 COVID vax has not been fully approved, but still EUA only? When do you think it'll happen? I think I answered that. So I think it'll happen in February. I'm not surprised. So my anticipation was from when it was fully approved to when it was EUA approved to when it was fully approved is about 6-7 months. And so we're in that time frame right now. What can one do when an employer requires weekly testing if not vaxxed, especially now the CDC withdraws the use of a PCR test for COVID-19 and Covet cannot differentiate between the flu and 19? So I disagree with this analysis. So the CDC withdrew their PCR test. Okay, they didn't say the FDA approves or authorizes PCR tests as they do vaccines and everything else. The CDC had a PCR test that they had come up with and that they put out there to use. Just like Yale University has a PCR test and, blank, blank, blank lab has a PCR test. The CDC withdrew that PCR test, so their own PCR test. There are still hundreds of PCR tests that have been emergency use authorized that are used. So that isn't accurate by saying, well, it's accurate that the CDC withdrew their test, but that doesn't mean that PCR tests have been withdrawn. They haven't been withdrawn. The FDA still has approved. The other piece is that the CDC withdrew their COVID test and they replaced it with a flu and COVID test. So they just replaced the PCR test with one that tests for both COVID and the flu, so that you can now tell whether you have flurona or not. So they didn't really, there's a understanding of what actually happened there. The one key thing that I would say is, if you're weekly testing, as I said, you want a saliva test. And I would also find out what your cycle threshold is. So your cycle threshold should be preferably below 35 in order for it to determine whether you actually have COVID or not. But most tests are at 40, which is high. And so anyone who has a COVID positive test at 40, my recommendation is go right out and get another COVID test and see whether you have COVID or not. If it comes back positive twice, I would say that it's identified COVID, because it's unlikely that you would have 2 false positive tests in a row. Okay, I'm trying to enroll my 3-year-old in preschool. They are telling me she cannot be enrolled because she isn't vaccinated. Even before COVID, my husband and I were against vaccines for religious reasons. I thought she would be exempt because she has an IEP for autism. How can I push back against this? So if she has an IEP, she is exempt from the vaccine requirements in California. And my recommendation is to go to an organization called Educate Advocate, and their website is educateadvocateca.com. And they are an amazing organization that work with special needs parents and kids. And if you're having issues with getting your kid into school on an IEP, as long as it is a public preschool, if it is a private preschool, they don't have to honor the IEP. Okay, next question. My daughter is currently in 8th grade. She has a permanent medical exemption for vaccination from her pediatrician in January 2019 and submitted her ME in 7th grade. Her doctor is not on the disciplinary list. Next year, when she enters high school, would her ME be considered grandfathered for high school since it's within a grade span checkpoint? Can they reject her ME or ask her doctor to submit an ME in the care system? Her high school has asked for a copy of the ME to help check. Should I send my daughter's ME? So your daughter should be grandfathered in. If the doctor has not been disciplined, then yes, she should be grandfathered in. And whether you send the ME to the school, I probably would. I mean, they're going to have to check it at some point. They should not require it to be submitted again through the Care ME system. It should be grandfathered in. How long do you think it will take until we know if Omicron will provide immunity for future variants? Well, I think I had this conversation actually with somebody yesterday, and I think it's hysterical because they're saying if you get Omicron, you won't get the Delta variant. And I was just like, oh, how do they know that? Have they done the research? Because if they did it in animal research or human clinical trials, then they wouldn't have completed that research yet. And how do they know that somebody had Omicron and got exposed to the Delta variant? Because in America, they're not testing for variants. The number of the sequencing of of the results doesn't happen other than in a very, very small amount. South Africa sequences most of their tests and therefore has a better idea. But I still would say, have they actually had somebody with Omicron stand in a room of people that actively have the Delta variant? No, they haven't. So I think it's all it's all made up at this point. I think where you see it is all these people who have Omicron, when will they get COVID again? And when will we have another surge of COVID? So I think it's probably 3, 4, 5 months down the road where they're saying, where people who got Omicron, do you know that you got Omicron? Because we don't have any idea if you got Omicron or not, because when you're tested, you're just positive. You're not tested for Omicron. But if you got Omicron, or if you got COVID right now, what we saw over previously is people who had COVID are not getting COVID twice. There are a small group of people that have gotten COVID twice. And my question to them is, number one, are you vaccinated? Because I think the vaccine messes with your immune system and allows you to get COVID twice. Or when you had COVID those 2 times, was it just you tested positive, and did you have symptoms both times, and what were your symptoms both times? So I think there's a lot of false positive, like a lot of the cases in the US, there are false positives mixed in with there, and there are people who were asymptomatic, tested positive for COVID. My question is, did they really have COVID, or was it a false positive? So I think we'll see it over time as to whether these people who have got COVID right now, how long it takes them to get COVID again, and whether we're even in a place where we're testing for it. Like I think we'll come to a place where we won't be testing other than symptomatic people will get tested, because it's just, we can't go on like this. I hope we can't go on like this. Let me put it that way. What vaccines are mandatory for middle school? So for, I can tell you that in California, the vaccines that are required are hepatitis B, measles, mumps, rubella, diphtheria, tetanus, polio, pertussis. What am I missing? Hib if you're not for middle school, Hib if you're under 5. I'm missing one of them. Varicella, chickenpox. And you have to have multiple doses of those. If I get terminated, can I apply for Covert? So I am not a unemployment or employment specialist. I should have started this whole thing off by saying what I usually say, which is I'm not a doctor, I'm not a lawyer, I have no credentials on any of this. I'm just extremely well read, and I read 18 hours a day stuff. So my brain is full of information, but I'm not anything, I don't have any letters after my name to make any of this credible from a legal or a medical perspective. My son is in a charter school under Oakland USD. They have adopted the OSD COVID vaccine mandate. My son already has an ME for all vaccines. The school may insist I turn in a newly minted form. I have informed them that their mandate is illegal and showed them the judge's decision overturning the San Diego mandate. Nonetheless, they may bar my son from school effective 2/1. My approach has been to ignore them and inform them that my son already has an ME and they have no legal right to require anything else. Would you do anything differently? I wouldn't. I mean, I think the best shot you have is to ignore it and to hope for the best. I do think there is, I'm trying to think if there's a lawsuit. I don't think there's a lawsuit against OSD. I thought OSD had a personal belief exemption, but maybe they don't. Maybe it's Piedmont that has a personal belief exemption. One of them has a personal belief exemption. And, if that is an option, then I actually don't think you have a shot at a lawsuit and ignoring it. I would submit the personal belief exemption. I believe Oakland has a personal belief exemption, but you have to get a doctor to write on it saying that they have told you the risks of the vaccine and the benefits of the vaccine and the risks of the disease, sorry. And so if you have that option, I would submit that. I'm against any vaccine mandates at all, but I'm curious about your thoughts about Novabax. So Novabax is supposed to come out and be authorized in the next few months here in the US. It uses the technology that the hepatitis B vaccine uses. So it is more tried and true. It is a more traditional vaccine, but I still don't trust it. So I don't trust the hepatitis B vaccine. So, I think for people, and you run into the problem, if you haven't taken a vaccine thus far, you run into the problem of you get vaccinated and you're going to be required to get the booster. And then you're in even more, you are less likely to be able to get approval of a religious exemption because you took the vaccine. And so to me, if you haven't taken the vaccine thus far, why would you take the vaccine? Any vaccine. It's still going to be rushed. It still hasn't finished clinical trials. It still falls into, all the categories of, is it safe and effective? We don't know if it's safe and effective. So I like the technology more. And I said this right at the beginning. If there was a vaccine I was forced to take, it would probably be the Novavax. But I still wouldn't take it. What is your take on 5G as a probable cause specifically for severe COVID symptoms? So this has been an issue since the very beginning of COVID that people have brought up, that it has something to do with 5G, spraying, everything else. I would say that does it impact? Yeah. I mean, I think we are bombarded every day by toxins. And so does that affect your, ability to have your immune system work at its full potential? Yes. Is there something that is 5G any different? I have no idea. I honestly don't. And I don't think there's been any studies done. But from a day-to-day basis, the more toxins, so that includes, the spraying that happens on the streets, the pollution, the stuff in your food, if you're not eating organic food, you take your water, what's in your water, you take all of those things, your nutrient levels, whether you've got vitamin D in you, whether you've got vitamin C in you, whether you've got zinc, whether you've got, or whatever, all of those things all contribute to how your body works and your immune system. And so, do I think 5G specifically, just that is a cause? No, I think there's so much more. You look at the people who are in hospital with COVID have comorbidities, and 80% of them are obese. I was talking to one of the people that works for a Voice of Choice Advocacy today, and she was saying, obesity isn't necessarily just from the food you eat. It's from the hormone disruptors that change your body, those types of things. So there's so much more there. So do I think 5G is a contributing factor? Probably. Do I have any idea whether it really is? No, but to me, it's all the toxins out there that we have. Okay. Am I still able to sue if my religious exemption is denied, even after an appeal, having the COVID vaccine as a condition of employment starting next school year? Yes, but what you need to do is you need to, number one, find out why they denied it, what their reasoning for denying it was. And number two, you need to submit a complaint to the EEOC and to the Fair and Employment and Housing Department in California. If you're not in California, you need to find your employment division and you need to file a complaint to them. So you need to file those two complaints and get responses to them before you can get a lawyer and sue. Do you know when the second dose of the Pfizer vaccine should be administered to be fully vaccinated? I would like to schedule the second dose 8 weeks apart or before the next school year, but not sure if the school will be asking for 3 weeks apart. I called the CDC yesterday and they told me it doesn't need to be 3 weeks apart, but not sure if the school will accept them if they are more than 3 weeks apart. So yes, fully vaccinated is changing the definition, but fully vaccinated should be 2 doses. And regardless of how far apart you have those 2 doses, it's the fact that you've had a second dose for the Pfizer and the Moderna vaccine. For the J&J vaccine, it's that you've had 1 dose and then you can get your booster shots. The way the CDC changed the language was that rather than being fully vaccinated, they say you're up to date. And so you're up to date if you have had the most number of boosters that you can have at any time. So if you've had the Pfizer and Moderna vaccine more than 6 months ago, then you would need to be boosted. Actually, and it's 5 months. It's 5 months ago for I think school children. Any guidance about the best approach for wording or exemption requests that has worked specifically for healthcare workers? So again, any exemption questions, come to one of our religious exemption workshops. The religious exemption workshops that we do we have been, I would say, 99% successful in getting them accepted. The accommodations may be denied, but for the most part, most people have been accepted, even their accommodations have been accepted. The places where people have been denied have been cases where they have been blanket denied. So it didn't matter what you wrote in your religious exemption. For example, the city of San Francisco denied every religious exemption. They did not accept a single religious exemption. It didn't matter whether you wrote 2 words or a beautiful exemption. They denied it. So, but for the most part, we've had incredible success with our religious exemption writing workshops and helping people put in the words that they need to use. The key piece, if you don't come to one of them, the key piece is that you don't use in what's on the internet. you have to write your own religious exemption. You have to write it in your own words, and it has to be your truth. And that's the key piece. And that, I think, is why we've been so successful. Do you expect the school districts to require to include the COVID vaccine in the 2022-23 school year? I think the earliest that it would be required is the 2022-23 school year, and it will have a personal belief exemption at least until January. It may have a personal exemption through the 2023 school year, but it will, and possibly longer. It really depends on whether the legislature passes a bill to remove the personal belief exemption. Do you think the HPV vaccine will be mandated for school? Affected when? Which grade will they check? So the bill that we are aware of will require both the HPV vaccine and the meningitis vaccine of high school students. And it would go into effect either January 2023 or July 2023. So for the 2023-24 school year. The key thing with those two, so will that bill pass? I think it has a good shot of passing in California. I think the key argument for us is that neither the HPV vaccine nor the meningitis vaccine, so neither HPV or meningitis can be caught in schools or is prevalent in schools, right? So HPV is human papillomavirus. It's a sexually transmitted disease. You're not going to get it at school unless you're doing stuff that you're not supposed to be doing at school anyway, and that's not, but that the school should be stopping that before we get to this place. And the meningitis vaccine is often required on college campuses if you live in a dorm. And so because it's transmitted through bodily fluids. And so that also is not something that we see as prevalent in high school. The two key pieces with that bill is, number one, it's being required of high school students. That means that there is now a new checkpoint for vaccines at high school, which there's never been before. So the checkpoint is 7th grade usually. And I don't know why it's Assembly Member Aguilar Curry is the one that's going to bring this forward. I don't know why she's putting in a new checkpoint at high school for the HPV vaccine and the meningitis vaccine. It would make more sense if I were her to put it in the 7th grade requirement, because there's already requirements there. But the word on the street is that it's going to be for high school. But the key argument there is that you don't get these things from school. And so why there shouldn't be a requirement for a disease that you can't get at school is our argument for it. We will be also, if it is moved forward, we'll be arguing for a religious and conscious belief exemption for that, for both of those. Okay, a person had 2 vaccines for COVID last year. Okay, I have. Okay, I answered that question. AB 1400 involves Medicare for all at the state level. The liberal, more established part of the Democrat Party have generally opposed this effort. Do you know how divided California lawmakers are on this bill and if it has any legs? So what's interesting, so AB 1400 basically is Medicare for all. So they're trying to get a system in place where everyone can have Medicare. There has been a pushback on that. And it is a huge budgetary implication. And right now, California has a budget surplus, but a budget surplus doesn't last forever. And so the key with AB 1400, number one, it has to be voted on in the next month. So it's a bill from last year that still is alive, and they have pushed it through. And so it will need to be voted on I think it's this month. I think it's by February 15th or so. Those bills have to be put through. So they will act on it very quickly. I think that's purposeful because they want it to be pushed through. The key piece with AB 1400 is that it doesn't have the budget associated with it. It just says, we're going to do this if there is budget. So it would be up to Newsome to put this in the budget. I haven't read through. He released his initial budget yesterday, and I have not read through it as to what it does on this front. I don't know how it pertains to this specific thing and whether he has it. There is a May revise, which is when the budget gets revised, and then the budget is voted on in June. So I do think it has legs. I wouldn't be surprised if it passes. I think there's going to be quite a bit of debate on it, but the key piece is whether it even has the budget to go with it. So it would cost a humongous amount of money to create Medicare for all at the state level. And that's been part of the pushback previously, is that California didn't have the budget, wouldn't have the budget, and that's the issue with it. So we'll see. Okay, hundreds of school boards are adopting resolutions to ban vaccine mandates. Will this hold up after the vaccines are mandated? Good question. I am very, very curious to see what those school boards actually do. I think it is wonderful that school boards are adopting resolutions to ban the vaccine. I think it is a statement, and it is a powerful statement to the legislature saying that we don't want these mandates. And that has never happened before. So in 2015 and 2019, we did not have any support from school boards objecting to the vaccine requirements and removing the personal belief exemption. The key piece here is, if the legislature passes the law, the question becomes, what are the ramifications if a school does not follow the law and follow the statute? And what will they be fined? Will their funding be removed? Will they not be allowed to do certain things? And so that's the key question there, is what if there is a law that's passed and they stand up and say no, will they, number one, will they actually do that? Because many of these schools, I think, will go into the mode of, well, we have to follow the law. That's the deal. And number two, if they don't follow the law, what will happen? So I'll just give you an example. There is a school in San Jose, a Christian school in San Jose, that was not following the mask requirements or the mask guidelines and the vaccine guidelines. And they had FBI warrants come after them for it. They had search warrants put on their premises. And so there's definitely scare tactics, and there's definitely, how much will these school boards actually stand up if the requirement goes in place, is my question. Is there going to be a new legal challenge for all childhood vaccines to have a religious exemption in California, given the makeup of the Supreme Court now? Yes, I do believe there will be. We are looking into doing that, yes. It's not going to be an easy case, and it will take time, so it's not going to be something that happens overnight. Are there other states considering school vaccine mandates, COVID school vaccine mandates, or is it just California? California is the only one that I have heard of thus far. If another state does it, my guess is it would be New York. Best states to move to with no vaccine mandates and no masking. Florida is the number one. South Dakota, parts of Idaho, parts of Texas, parts of South Carolina. The interesting thing is, I think Kansas too has a ban on vaccines. So Kansas and Florida, I think, the only ones that have proactively said no. The interesting thing that I found, I was researching states, and what I found was a place like South Carolina that they banned mask mandates in school. They don't have any mandates. So they have no masking mandates. They have no vaccine mandates. But what's interesting in that state, I was looking specifically at theaters and acting. And what's interesting there is that the theaters themselves have put mandates into place that require vaccines. So the state doesn't have any requirements, but they individually, I mean, it's democracy at its best. They individually, each theater has said, in order for you to be on stage, you have to be vaccinated. What's interesting, if you then go to North Carolina has a mask mandate. So you have to be masked inside with greater number of X people, blah, blah, blah. And for theater there, you have to wear a mask, but vaccines aren't required. And so it's actually an interesting dynamic I found was that because North Carolina has this sort of, okay, where you have a mask mandate, nobody's going beyond that and requiring the vaccine. But in South Carolina, where there is no mandate, the individual places, individual theaters are requiring a vaccination to be on stage. So if you are looking into this, I wouldn't just look into the fact that they have no mandates or no masking mandates or no vaccination mandates. I would look at what's actually happening on the ground where you move. And I would also say that there are some states that have some requirements, but they're local requirements. So they're in certain areas and not in all areas. But Florida is the one place that has banned the requirement of masks and the requirement of mandates, and nobody is allowed to mandate it. So that's, the Florida climate is not where I would want to live. How can we fight for our stance against a judge in family court when another parent wants to suddenly deny a prior ME to win custody or choice to vaccinate for the vaccine? Does a judge have the right to do this under EU conditions against the ME? So I'm going to assume you're in California because I know the California court system, having being in it. If you're not in California, then what I say may translate or it may not translate. In California, the family court system is the worst court system you can be in. It is the most biased court system. It is not even what I would call a court system, because when you're submitting things, they are not based on any facts. They are not based on anything other than your word against your ex's word. And you file your brief that says, I believe this, and your ex files a brief and says, I believe this, and you write back and you say, I believe this. And then the judge bases it on those statements. And my experience is that if you are a non-vaccinating parent and your vaccinating parent suddenly decides that vaccination is the thing to do, they will write all sorts of lies. They're most likely a narcissist. They will write all sorts of lies about you, make you look like the worst person in the world, that you don't care about your child, that you've never cared about your child. And more often than not, the judge believes it. I will say you need a really good lawyer, and a lawyer who has experience in arguing this. There are very few of them in this state. If you're in the Bay Area, you can email me, and I can share the 2-3 lawyers that can help you. I know they also do consultations, but it's really, really hard. The key piece that I would argue, the key argument that I have seen work, is that there is not a change of circumstance. So your children, and it's actually best, it sounds like your ex was on board with the medical exemption. So if your ex has been on board with the medical exemption, you have a much better chance of winning, because the change in circumstance, they have now changed their mind. They don't get to, that doesn't mean other things change. So that piece of it. The other piece that people ask me about is whether you want a long trial, a long cause hearing, which means you can bring experts in. I would do that if it makes sense in your situation. It's really a situation by situation. It depends on what your ex is arguing. It depends on the history of it. But it is hard. Family court is the worst place. I will be honest. I lost vaccine decision-making, and my ex has vaccine decision-making. Now, my children are still not vaccinated because they are old enough that they have said no. So if your child is over 10 years old, it's also up to your child to take their stand. And it's a place where I do advise for 12-plus-year-olds to have the decision-making because they can also say no. So there is a piece of that law, and that, the age piece that is of advantage when children are educated and know what they want. So, okay, it is 8:30 and I have 93 questions. So I'm going to see if I can get through them. I will be on for at least another hour, but I would say if you haven't asked your question so far, either don't or go through and have a look whether There's another question similar to yours, because I'm going to guess some of these are repeats. Okay, in February, my company is requiring all employees to submit their vaccine status. If you're unvaccinated, you must test weekly. Because they're not requiring a vaccine, should I submit a religious exemption? Would it do anything? It would do absolutely nothing. I would not submit it. I would just state that usually they say you can either be unvaccinated or decline to state, and they treat you the same way, but I wouldn't submit a religious exemption at this point. Do you think that California will also try to mandate the regular annual flu vaccines for school attendance? So there is nothing that shows that they will do that. Could they? Yes. But right now, I don't see it happening. Initially, public health said that wait 90 days after the COVID to get tested again. I thought because doing so sooner might yield a positive result. Now, after 5 days of becoming positive, one can test. And if it's negative, you can return to school, work, etc. So what was the purpose of the 90 days? This seems a huge inconsistency to me. Thoughts? I completely agree with you. And I actually have a child, not my child, but I have somebody, a friend of mine, whose child tested positive. They believe the child was sick over Christmas. They believe that was the COVID, but the child didn't get tested at the time. So it's not clear if that was COVID or if it happened later. But the child tested positive, waited 5 days, is still testing positive, has 0 symptoms, has not had any symptoms since Christmas. So yes, I don't understand this 5-day thing suddenly and it's interesting because my daughter's school still has the 90-day rule. So after 5 days, if you're vaccinated, if you tested positive, you can come back after 5 days without a test if you're vaccinated and you're asymptomatic. So they are determining it on whether you have a fever and whether you have symptoms. I think the 90-day rule should still apply because it seems that you would still be positive for COVID after 5 days. But I don't understand. I haven't found the place where it specifically says, I was looking up the 90-day piece and it doesn't say, it says if you are, so the CDC wording isn't that you shouldn't test. It says that if you have symptoms for the next 90 days, you shouldn't, you don't need to worry about it. You don't need to worry that it's COVID. But there's nothing, I haven't found the place where it actually says do not test for 90 days, and it may be because they've taken it down. But yes, I think it's bizarre. But in this day and age, everything changes. They change, they move the goalposts constantly. So I'm not really surprised anymore by it. Okay, my employer, Facebook, does not allow people to return to the office without the vaccine. They offer the option to work from home, but I am a chemist and need to work in the lab on site. They told me that my religious exemption was denied, so I'm not sure what to do now. What would your advice be? I think, so the key piece is, again, if your religious exemption was denied or the accommodation was denied. So if the religious exemption was denied, I would ask them why your religious exemption was denied. If your accommodation was denied, which is that you work on site, I would, again, I think in all of these cases, I would argue for them to prove to you that you as an unvaccinated person, masking, testing, whatever you're doing, are more of a risk to be in person than the person that's vaccinated. Okay, any chance the legislature will pass a law for no personal belief exemption for COVID schoolmen? Yes. That it would be effective, okay, sorry, this is a new question. So that it would be effective before, so pass a law without the personal belief exemption, that it would be effective before January 2023. It is incredibly unlikely that that will happen. For the legislature to do that, they need a 2/3 majority vote. And there are 2/3 Democrats, but to get a 2/3 majority vote in both houses on this issue, that would be a miracle for the legislature. So I just don't see it happening now. Here is a proposed rule for the Federal Register to collect data for those who have requested religious exemptions. I'm very concerned about state and federal government creating a religious exemption database to discriminate against them, and who knows what other nefarious actions against people for the religious beliefs. Biden has threatened people who are not vaccinated. So I think it will be, I haven't seen the Federal Register, so thank you for sharing that. I will go and look at it. I think something like that, if it's done on a federal level, will be questioned in court. If it is done on a state level, what you have to realize is every state, most states know exactly who's been vaccinated and who hasn't been vaccinated, because they have a list of all the people that have been vaccinated, and they've been putting that into the immunization registry. So, I think from a state level, they don't even need a religious exemption database. They know who's not vaccinated. They could put it all together. Okay. My company has stated repeatedly that they cannot accommodate regular testing for staff, vaccinated or not. How are they authorized to seek recover of COVID-19 related costs incurred through existing rules that govern our operations? How do you recommend this aspect be used to convince leadership to take an alternative approach to the vaccine mandate that they've instituted? So I think you need to work out what money they've been given and whether that money could be used for testing. The other piece now, like Biden, I think, said to insurance companies that they need to allow for 8 home tests per month per person. I read that today. But the other piece is that insurance companies are paying for testing now. So I would go to them and say, if I could get tested weekly, twice a week, whatever you're willing to do, and I cover it, i.e. your insurance covers it, would that be acceptable? And try and convince them in that way. And argue, to me, a person that is tested, and yes, there are false positives, so don't get me wrong that this isn't the fail-safe place, but a person who is tested who is negative, so there's many more false positives than there are false negatives. A person who is tested negative knows that they're negative and knows that they don't have COVID and they're not spreading COVID. They are more safe to be around from a transmission perspective than somebody who's vaccinated and isn't tested, because the vaccinated person can transmit COVID and can get COVID. So to me, making that argument makes sense. My argument is everyone should be tested. If you're going to test anyone, everyone should be tested, because the unvaccinated are no different from vaccinated. If your true purpose of testing is to remove the chance of someone, transmitting and spreading COVID. If the CDC is requiring N95 or K95, then all employees in a medical clinic should be wearing them currently. I work in a medical clinic, and because I am unvaxxed, I'm the only one wearing it. Vaxxed or wearing a surgical mask. I thought if the CDC mandates this, then according to my company, I'm working with a high-risk environment, then I can ask my employer that all should be wearing the same mask. I am singled out, and since I'm wearing a different mask, N95, that singles me out and states my personal medical choice. What can I do? I feel obviously discriminated against. Don't I have privacy rights? So I don't think there is a mandate that requires, I don't think the CDC is requiring anything. The CDC is recommending N95 and K95 masks for just in general. They're saying that those are better than cloth masks. I think you could go to your employer, and again, I would use the Omicron argument, which is if you as an unvaccinated person need to wear an N95 mask, then everyone else does, because they are also transmitting and spreading Omicron. I think that's the argument that I would use. I think Omicron in this case is our friend. COVID right now is our friend, and the way the vaccines are working is our friend. I also am surprised that there aren't other people that are wearing N95 masks in that setting. So my perspective, I was out and about today, and I would say, I don't know, 50% of the people that I saw wearing masks were wearing some form of N95 or KN95 masks. So, I'm surprised that you are the only one wearing that type of mask, because at least in the San Francisco Bay Area, everyone seems to be wearing them, and everyone's wearing the masks outside again, which is lots of fun. Are there any safe vaccines, subunit protein vaccines? So personally, I don't think there are any safe vaccines. Well, let's put it this way. What is the definition of a safe vaccine? All vaccines, all medical products have side effects. You just go look at their package inserts. There's a list of side effects. So the real question to me isn't whether they're safe. It's doing a risk to benefit ratio for an individual person. So for me personally, as a healthy person who eats healthy, who removes as many toxins as possible from my lifestyle, my belief is that the benefit of a vaccine, the risks of the vaccines outweigh the benefits of a vaccine. And I am fine with knowing that I could be exposed to a number of diseases that I may get and a number of viruses that I may get. But my perspective is my risk to benefit ratio, my personal risk to benefit ratio, weighs in the favor of not taking vaccines. Now, if there was somebody who was elderly, obese, had comorbidities, doesn't eat well, and they came to me and said, what's the risk to benefit ratio? I would, say to them, work it out and work out whether the vaccine makes sense for you. But it's really an individual basis, and what the risk is of the disease, what the risk is of severe reactions to the disease or severe outcome of the disease, symptoms of the disease, what the risk is of death from that disease for the individual person, and then the same for the vaccine. So from my perspective, me personally, I don't see that there is a vaccine where the benefits outweigh the risks. Okay, our company granted a religious exemption, but said we need to test. We have said that it's against our religious beliefs. Do they have any ground to fire me, as this is an EUA and the PCR tests were taken off the CDC list of recommendations? So again, the PCR tests were not taken off the CDC's list of recommendations. The CDC just discontinued their brand of the PCR test. I have not seen a religious exemption be accepted for testing. I have seen people opt for saliva testing as an option, but you don't need a religious exemption for that. And the saliva testing, because you're spitting out. So there's nothing, there's no religious beliefs that say you can't do that. Or, I think it'd be hard to argue it. So I haven't seen a religious exemption be accepted on masking or on testing. And if they have, it's to do an alternative. So if somebody's gone, I've seen people be accepted without a religious exemption. So it's either as an alternative getting saliva testing, or like masking, wearing a visor with a cloth drape around the bottom or something like that. Okay, do you think vaccines will be required for homeschool children? My children are enrolled in a public homeschool. I don't think they can be. So I think they're going to attack homeschools from a completely different angle and tighten up on who can homeschool, those type of things, before they require vaccines of homeschooled children. I think that would be an ultimate lawsuit, because there is no schooling option for children then. If you can't homeschool and you can't send your child to school, there has to be an option for them. And that's, the argument they've made all these years is you don't need to be vaccinated because you don't need to go to school. You can homeschool your kid. I think before they do that, I think they would be more restrictive on the homeschooling aspect of it and try to make it much harder for parents to homeschool their children. The San Diego Unified Brief, is it public? Can I get a copy of it? It is. I don't have it easily accessible, but I'm sure if you search for it, my guess is it's on. So it was Let Them Breathe that did that lawsuit. Let Them Breathe, Let Them Choose. If you go to letthembreathe.com, my guess is it's on their website. Can you provide some sort of form of legal letter on a legal letterhead that we can use to send to our employers and agencies that might intimidate them into honoring the religious exemption? I have been told by my agency that I can't work as a freelance interpreter for them if I don't get vaccinated, and it's too much work for them to bother with exemptions. So freelance agencies, so can we do that? Yeah, it's something I hadn't thought of, but I think we can probably get a lawyer. The problem is, once you get lawyers involved, they start talking lawyer to lawyer. So I'm trying to think. It's a letter that we could put together, but the problem is, if you put it on a lawyer letterhead or a legal letterhead, it means that lawyers then get involved, and their lawyers are going to get involved, and it expands greatly into what you're paying and what you're doing. The issue with freelance contractor positions that we found is it's a really tough area, because what we found is that the contractor company is willing to allow religious exemptions. In this case, it sounds like they're not. But what they're not willing to do is to then work out with the companies they're contracting you to that whole scenario. And that's where they can't be bothered. And they don't want to, basically they don't want to fight for you. And so my recommendation there is to ask your agency if you can do, you want them to place you, and you will do, your sort of bidding on the religious exemption. Now, there are some companies that won't accept the religious exemption, or won't. Companies can be more picky with contractors and say, we don't want anyone that's not vaccinated, because it's different than because they're not their employee. It's a tricky situation. Are they legally allowed to quarantine unvaxxed children for exposure at school, but not vaxxed children? Yes. So the way that yes, the way that CDPH wrote it and the way that the CDC has written it, yes. It all is defined in like what a close contact is, what an exposure is, that type of thing. I work for a privately owned utility company in California. They're mandating all of us to be vaccinated and did not give an option to test weekly because how costly it would be for the company. Now that Biden has said insurers will cover up to 8 at-home virus tests per month for free, can I fight the mandate and test weekly? I would absolutely. As I said, I would use the arguments that I gave, that the people who are testing are more safe than people who aren't testing. Since none of the vaccines available are FDA approved, how can they force you to take it? So the Pfizer vaccine is FDA approved for 16 and up, 16 and up, 18 and up. I'm not sure, I can't remember, but the Pfizer vaccine is fully FDA approved. I thought you can't be forced to take an EUA vaccine. Could you tell the employer, sure, I'll take the FDA approved vaccine, but there's no place to get it. So yes, so the Comirnaty, the Pfizer vaccine, is not available. You can argue that, but your employer is quite happy to fire you if you do that. So I think you run that balance point of, yes, you can argue all you want with your employer. If you're in California, and I think it's 37 other states, you're an at-will employee, they can fire you tomorrow for no reason at all. If they fire you for not following policy, i.e. getting vaccinated, then then you don't get unemployment either. Is there any talk of recognizing natural immunity yet? The NCAA just announced it. I think we're going to get there. I think what they've realized, I think natural immunity, they didn't want to give it too soon because then people wouldn't get vaccinated. I think now that they are not running out of vaccines, but they've gone through all the ones that they previously purchased. I think we will get to a place of natural immunity. I think it's also because people who got boosted and vaccinated or getting COVID, that they now are just like, well, what does this mean? So, are any medical exemptions written by doctors who have a medical board accusation filed against them revoked? Or does that not happen until they're disciplined? Is information on doctors who have been disciplined sent to the schools routinely, or does school staff need to check the medical board website? So if you have been accused, it doesn't mean anything. So they do not get revoked until you have been disciplined. If you get disciplined, it's not clear what CDPH does or what the medical board does. So a year ago, the medical board through CDPH released a list of all the doctors that have ever been disciplined. It had more than 9,000 doctors on it. The majority of them were disciplined for everything under the sun, such as opioid medication prescription abuse, to sexual abuse, to everything under the sun you can imagine. That list was sent to the school. So CDPH sent an email to the school saying, if you have medical exemptions, this is the list. If you have medical exemptions from these doctors, revoke them. And so schools went through a spree of just revoking all sorts of medical exemptions. It is not clear whether when a doctor is disciplined for vaccine issues or for any issue, how often CDPH and the medical board updates that information. Now, I do know that either schools are on the lookout for it or they are somewhere. I believe someone's alerting them. Let's put it that way. So Dr. Sutton, Dr. Kelly Sutton, her medical license was revoked starting January 1st. And I have seen a number of schools send out letters to parents who have medical exemptions written by her, have them revoked. So I feel like that wouldn't have happened without someone making them aware of it. Like, I don't think schools are routinely in January going through medical exemptions, going, oh, we've got a medical exemption. Oh, we've got a medical exemption. Let's go look up the doctors. I just don't think they are. So I think for the most part, most schools are not looking them up. I do think something triggered that. And I don't know what it was. I don't know whether it was just, those schools were intent on it, although they were public schools. And I feel like something went out, but I don't know how often it's going out. So I don't have a real answer, but something's going on there. Are California doctors actively giving medical exemptions after the MMR and varicella positive titers? I believe they have to go through the ME system for approval. Yes, they are. And that is the one place that I haven't seen those medical exemptions be revoked. So it has to go through the CARE ME system. And if a doctor has been disciplined for the vaccine issue, they can't put anything in the CARE ME system. But if you have a doctor and you have positive titers, you can put that into the ME system. And I haven't seen those ones being revoked. So it seems like that's an okay reason to give a medical exemption. My landlord is requesting weekly nasal test, but I've asked for saliva test and been denied. What can I do? Do you think there's something nefarious about the tests? So number one, why on earth is your landlord requesting a weekly test? Maybe your landlord lives with you and therefore they can do that, but your landlord shouldn't be requiring testing. But okay, if they are, I assume you're okay with this. So the key piece between nasal tests and saliva tests. I don't like anything put in my body that I don't know what's in it and that has chemicals on it. So the swab for the nasal test has chemicals on it. Do I know what chemicals they are or all the chemicals they are? I do not. Do I know whether they have dust with nanobots on those swabs? I do not. Do we have the capability in the United States of having nanobots that are the size of dust that could be on those swabs? Yes, we do. Answer is, I have no idea what's on the swab. There is something on the swab. There's definitely chemicals on the swab. And I don't want to put the chemicals into my nose, and I don't want to put that in my nose. So for me, doing a saliva test, spitting out is what I would do, because it's coming out of me. And so that is the difference. The times when, if I had to do a nasal swab, I would, and it's a home test, for example, I would probably blow my nose into something and kind of, put the swab into that and then test it. But I'm not a fan of sticking things in me that I don't know what they are. Okay, my district sent an email saying that the religious exemption are until June 2022. How can I prepare and make sure my job is not jeopardized for the next academic year? So this is one of these questions that I get asked, and to me, there's no end date on a religious exemption. You either have religious beliefs or you don't have religious beliefs. It has to do, if they've accepted a religious exemption, then your religious beliefs don't go away. They can't suddenly say, oh, there's no longer a religious exemption. Kaiser is another one that's just gone through a whole slew of, they accepted a lot of religious exemptions in August, September. And this year, they've now sent out, that was temporary. They said it was temporary when they approved them. But now we're denying you your religious exemption. And I'm kind of like, okay, but you accepted it. My guess is Kaiser was filling those positions along the way, and they now gotten to the point where they can let those people go. would be my guess at it. Okay, can you explain how, if the BioNTech Pfizer is not FDA approved, only Comirnaty, not sold in the USA, they can mandate an EUA drug? So they can't mandate an EUA drug, although that case has not been won in court. Comirnaty is not available in the United States. I agree with you. The key piece here is they don't care. And by the time that lawsuit goes through, there are lawsuits based on this, but by the time that lawsuit goes through, Comirnaty will be on the market. The key reason why they're not putting Comirnaty on the market is twofold. One reason is that they need to get through and get rid of all of the Pfizer-BioNTech EUA vaccines that have been created already. And there's a surplus of those. So once they get through all of those, then Comirnaty can get on the market. The other piece is they need the FDA approval for a childhood vaccine in order not to have liability. So right now, under the EUA, they have no liability, and it's under the PrEP Act that you can go file your claim. Once a vaccine is approved, fully FDA approved for children, then they have no liability under the vaccine injury compensation program. And so they need the vaccine to be approved, fully FDA approved for children. And once that happens, my guess is we're going to see Comirnaty on the market, because then they have no liability. If they had Comirnaty on the market right now for adults only, it would have liability, and they don't want to have that liability. Santa Monica City Council is proposing a vaccine passport tonight. What are an employee that works on the peers options to be able to continue working? The real question is, do they include a religious exemption in that? The interesting thing, for example, in New York City, you cannot go into a restaurant without a vaccine to eat in the restaurant. But if you're employed, they have to allow a religious exemption. So I think the same thing would be true of that. You indicated least mandated states: Florida, South Dakota, Kansas, parts of Idaho, and Texas, and South Carolina. Is Tennessee also considered a less mandated state? Yes, Tennessee is. There are other ones that I didn't mention. Those were the ones that were sort of off the top of my head. The other thing that I would look at when you're looking at a state is states that have been fighting the school vaccine issue over the years. So, for example, Texas, every single year fights the school vaccine mandate. What's another one? Arizona is another one that does that. And so while those states may be more open, and they may change, with the COVID vaccine, they may change that. But I wouldn't go to a state that has been fighting the vaccine issue, the school vaccine issue, and been trying to remove the personal belief exemption or the religious exemption in a state. I would stay away from those states as well. So I don't know, as somebody else, about a medical exemption for a high schooler. I don't know of any doctors giving medical exemptions in California, because they've been witch hunted. They go after those doctors, and because you have to put it into the CARE-ME system, the doctor is registered in there. So I don't know of any doctors other than oncology doctors that are willing to write exemptions, and some for titers, for antibody testing for the MMR and varicella. But other than that, I really don't know any doctors that are willing to do it. Do you have any resources for a rookie to learn about homeschooling in California, particularly unschooling? My son will be in first grade next year. There are so many wonderful resources for homeschooling. The first place that I would go to is HSLDA. They are a legal entity that help parents with homeschooling, and they have a huge library of things that you can that help you with homeschooling. But I would definitely become a member of HSLDA, because they, for example, will give free legal advice if CPS comes to your door or something like that because you're homeschooling. I think the other thing that I would do is go onto Facebook and specifically ask for or search for homeschooling and then put in your county or your area and find a local homeschooling group. It really depends where you are. There are plenty of groups in LA. There are plenty of groups in Southern California. I know in the San Francisco Bay Area, there are wonderful groups too. It really depends where you are and the resources there. So I would look locally, because you're going to want parents that have gone through it and have the experience locally to sort of guide you through it. There are lots of homeschooling programs that you can be a part of. But the other thing that's become huge, and it doesn't really apply to unschooling necessarily, but the other thing that's become huge in COVID is homeschool pods. So finding, having 8 6th graders all be part of a homeschool pod where they hire a tutor to teach those 6th graders and do activities together. And do you think society vax mandates will be approved? When? Effective or earlier? So I think you're talking not about local ones. So, not the ones like in San Francisco or LA. If you're talking about the legislation, I think it'll be hard for them to be approved. I think there is a lot of, so what we saw at the end of the last legislative session is that there was a lot of pushback from businesses and from the Chamber of Commerce's and those types of things, because businesses are already struggling. And so I think it will be hard for it to pass. And I think there's a lot of different questions. I think the bill at the end, if it does get to the governor's desk, will look very different from the bill that gets dropped in the next few days. I think for most of these bills, they will look different at the end. Okay, do you know if a religious exemption will be allowed for the COVID shots in public schools? So right now, we don't. We are going to, if that bill is dropped, we are going to argue that there should be one. I'm curious about the state differences and whether or not you think they will remain not federalized to all be the same. So I think the way our Constitution is written, there is no way that federal law will trump state law. And I think that's what we're seeing in the Supreme Court say at this point, that this is the vaccine issue and the public health issue is really a state issue, not a federal issue. I mean, that's in our amendments. If it becomes a federal issue, then we've lost a lot more than we've lost the basis of the United States. So that we were founded on. Is there any other state with age 12 plus consent without parent consent? What is most states' consent age? So most states it's 18. Washington, D.C. passed that law last year that 12 plus year olds would be able to consent to medical treatment. I think it was just vaccines, but definitely medical treatment, but if not, general medical treatment. So my son is fully vaccinated and they're requiring an additional booster for UC system. He is recovered from COVID. Is there any blood test like titers that could get him that would prove recovery from and therefore immunity of COVID that he could present in lieu of that? It's a really good question. And the answer is the US doesn't recognize that right now. And so, but my recommendation, so you can get antibody tested at like the Quest Diagnostics, LabCorp, places like that. So my recommendation would be to try. Go get the immunity test, see whether he does have immunity, whether he does have antibodies, and present it to them and ask them, if they would take that in lieu of it. I think it's a lawsuit waiting to happen. The key piece that I think they're going to say is, well, he has antibodies today, but we don't know when his antibodies will wane. And so is it a temporary thing? I do know that many people who have had COVID after 6 months, it's no longer in the blood in their antibodies. Now, does that mean they still have immunity? Very possibly. It's in T cells, B cells, all sorts of things. Our immune system is so amazing and we don't understand most of it still. And so, but if he has antibodies, it's more likely that he that would be a good reason, but I have not seen it be accepted anywhere. How can you get a personal belief exemption for the COVID vaccine? So if it's for K through 12 school, which is the only place that it usually is, if it's for K through 12 school, if your school is requiring it right now, they will have a form. If your school isn't requiring it right now, when CDPH puts that through, CDPH will put a form out that will be required to be the form. Now, my guess is that that form will be similar to the form that was in existence prior to 2015, and it will have that your doctor has to sign it, that you have to have gone to your doctor and your doctor has to have discussed the risks and the benefits of COVID and the vaccine, and that you are required to get them to sign it before it's valid. Now, pre-2015, doctors did that no problem at all, because they're not signing a medical exemption. They're not sharing their medical opinion on whether you should get the vaccine or not. All they are doing is signing that they have had the conversation with you, saying that these are the COVID vaccine benefits, these are the risks of not getting the vaccine, and that you have listened to them. Having said that, what I've heard, so I think it's Oakland that has that in place, and what I've heard is that people are finding it very hard to find a doctor to do that. And I think it's because doctors are getting confused that they're not signing a medical exemption. And so if you're in that situation, my recommendation is to tell the doctor specifically that it is not a medical exemption. You just need to sit down and have them tell you about the vaccine. And once they've done that, they're signing a piece of paper saying that they've had that conversation with you. I heard KN95s are required for employees only for my school district and not for the students, although I do not think students know this. One of my admins emailed staff saying that we cannot mandate the KN95s for students. That's fabulous. If they have any backup for why that is, I'd love to see it, because we're running into that issue. I don't think they should be able to, because CDPH says that, they're not appropriate for children, but I think schools are doing it anyway. I know schools are doing it anyway. What can we do to fight the California legislature that could enforce vaccine for all state residents without exemptions? So I don't think they really would do it for all without exemptions. I think if they were requiring every person in the state, they have to tie it to something. They have to tie it to employment. They have to tie it to your driver's license. They have to tie it to something. And once they start tying it to that, they have to have exemptions of some sort, because it'll be a lawsuit and it'll go to the Supreme Court, and the Supreme Court will say, no, you have to have exemptions. So if some are starting to accept natural immunity, should we just try to be infected with COVID? How do people go about proving natural immunity? There's a piece of me, I had this conversation, my daughter's school, they're allowing the 90-day piece. And I was just like, at this point, I just want to do a chickenpox party and, a COVID party and just get COVID and have her get COVID. So that it's done and we get 90 days off from all the testing. I think the way to prove it would be a positive test or titer testing, although the titer testing is not recognized right now. So I think that it's an evolving process. Do you know what the current definition of fully vaccinated is? So that's a trick question, because it depends on who you ask. So for some, fully vaccinated is 2 vaccines. So for the CDC, for example. But for others, it is what they changed the definition to, which is up to date, which means the most vaccinated that you can be. So if you're eligible for a booster, that you get the boost, that you have the booster. In speaking with legislators, are you suggesting tying in the risks of 5G and its interaction with vaccines? No, absolutely not. People will think you are completely crazy loon. So when you're talking to legislators, you have to talk to the people that you're talking to. So you have to remember that the majority of legislators are for the vaccine, want as many people to be vaccinated as possible. And so I don't talk to legislators from a anti-vaccine perspective. I talk to them from an anti-mandate perspective. This should not be required of anyone. And it depends on who you're talking to. If you're talking to Democrats, I talk about equity and justice and inclusion and discrimination. If I'm talking to Republicans, I talk about parental choice and individual choice to make decisions, bodily autonomy, that type of thing. Bodily autonomy should be a Democrat thing to talk about, but you also, the Democrats and liberal people, they think you're selfish for not getting the vaccine. So you need to point out how it doesn't have something to do with being selfish, that it's about not having to be required to get something that is not fully approved, that the clinical trials aren't finished with. But no, I would not tie 5G into it at all. Most legislators think 5G is the most wonderful thing on earth. So you don't want to counter them specifically on, unless you have, studies that, and if 5G is what you want to talk about 5G. If vaccines are what you want to talk about vaccines. But I wouldn't commingle it. My point was the toxic load on our environment, on us, on an individual person every day, that the onslaught of that is huge. I think you can talk about health. I think you can talk about obesity. I think the effects of that on us, the comorbidities, how sick people are and how they could become healthier, I think you can talk about, but I wouldn't go into specifics on, I wouldn't go into anything that is, if you put their hat on, put them as a person into you, and how would you talk to them? How would you want to be talked to in order to be convinced of a different opinion? Oh, somebody posted the new definition of a vaccination. Yes, the CDC has changed their definition of a vaccine and vaccination to accommodate the mRNA vaccines and the fact that they don't stop transmission or anything like that. If I decide to get the COVID vaccine due to a mandate, does it make sense to somehow document this, that it is not voluntary for any reasons, like maybe legal action later on? So I think you could do it from, if you did it from a religious perspective, you could say that you're going against your religious beliefs. But if your religious beliefs that are that strong, they should trump, they should trump that. I think the key piece is, are you really okay with taking the COVID vaccine? If you're okay with taking the COVID vaccine, then that trumps your religious beliefs. And if you're putting your religious beliefs below the COVID vaccine, then that's saying something about your religious beliefs. So you can document it. You can say you were coerced, but I would make sure that you've, supplied a religious exemption first, and that you're doing it under duress. I don't think it hurts to do that, but I would go through all the steps before you just take the COVID vaccine. Will the change in definition help in writing a religious exemption? It doesn't, because your religious exemption has nothing to do with the science or the definition of a vaccine. Again, come to my religious exemption writing workshop. And what about the mask mandate linked to the outrageous money in the districts receive from the feds if they follow the guidelines which require masks to be worn by children? I'm not sure what the question is there, but yes, the districts have been given a whole load of money, and yes, they're requiring the vaccine, they're requiring the masks. I think for the most part, most schools, public and private, are just following the guidelines, and that's what they'll tell you. Just doing what we're told to do. My child's school that's requiring the N95, KN95 masks, the sentence that I have gotten back with every email that I've written is, we are just following what was told to us by the Santa Clara County Health Department in our weekly call for schools. We're just following the rules. We're just following the guidelines. And when you say they're just guidelines, they say, yes, but that's what's recommended. And so we don't want to spread COVID, so we're going to follow the guidelines. And there's really not much you can do about it. Did Newsome announce the school COVID vax mandate based on the state emergency powers he currently had, or could he have done that without emergency powers? So Newsome cannot require the COVID vaccine without emergency powers, but that's not what he's doing. What he said he's going to do is he's going to authorize CDPH to require the vaccine, which can be done without any any powers. It says that in the statute. Okay. Are you familiar with Peggy Hall, founder of the Healthy American, and her work with helping people with paperwork on mandates, masks, and testing? What are your thoughts about her work, if you're familiar? I do know her. I am familiar with her work. With the religious exemption, my concern with her stuff is that it is very templated. And I have seen people have their religious exemptions denied. I also have seen them denied because her husband, who is a pastor, you can buy a religious leader letter. And I have seen those be denied specifically on that because it is not sincere. Again, I would take my religious exemption writing workshop if you're interested in that. But I just would be cautious about, I think for everyone, you need to, and including the stuff that a Voice for Choice Advocacy puts out, you need to make an informed decision. You need to work out what people you follow and what you take from each person, and do research on it. Aborted fetal cell lines. Several people got pushback for this argument. What can the kids say when they're questioned about it? So aborted fetal cell lines are used in the testing of all 3 vaccines in the United States, COVID vaccine. They're used in the manufacturing of the J&J vaccine, so it's in the J&J vial. I'm not sure exactly what you're saying, what the kids can say when they're questioned about it. I would say that they're against all abortion, if that's what they're against. Like, I think you have to have the conversation with your child about what are their beliefs with respect to abortion. For some people, anything that is tainted with aborted fetal cell lines is against their beliefs. It's not something they want to use. For some people, if it used in the testing and it's not actually in the vial, they're okay with that. So I think you need to have that conversation with your children or whoever and determine where you draw that line. There is a scientific research group that has done statistical studies on VAERS data. Their results are indicating that specific batches are more harmful or deadly than others. Is this type of information likely to be used to show the experimental nature of vaccines despite their FDA approval? So I have seen that website too. There are usually hot lots in vaccines. So in previous childhood vaccines or regular vaccines, they found that there were hot lots, and rather than, and what was happening, I think it was the Tdap, it was the DTP vaccine. What happened was there were hot lots, and the whole lot was being sent to one pediatrician. And so a pediatrician was seeing a huge number of adverse events in their practice, and that was considered a hot lot. What they now do with vaccine lots is they divide up vaccine lots and send them all over the country. And so you don't see as many hot lots, because if there's just one reaction or 2 reactions in a pediatric group, they may not report it to VAERS. Whereas if you saw 10 or 12 vaccine reactions, it would be more likely that they would think of it as something wrong with the vaccine than just a random occurrence. That's just history of vaccines. But with that lots for the COVID vaccine, I think it should trigger something, but so should just the plain old VAERS data trigger something. The fact that there have been so many entries into VAERS for injuries and death, even for the pro-vax side to say, oh, but VAERS isn't viable in the, anyone can enter something into VAERS, which is true. Anyone can put a complaint into VAERS. But the fact that there are so many of them, even if only 1% were true, that's still a huge number of injuries and deaths resulting from these COVID vaccines. But the FDA and the CDC have basically completely ignored them. Number one, because most of them are just systemic reactions. So they're just, oh, you had a cold, or you felt like you had the flu, you had arm ache, it went away after 2-3 days. We're good. But even that should raise concern. The fact that other countries have stopped giving vaccines to kids and to teenagers. The fact that they have taken certain vaccines off the market for certain groups of people, to me, why haven't we done that? We have the largest population to glean from on this data, and I have seen close to nothing be done with the VAERS data. It's criminal. It truly is criminal. Do I think that it will be used to expose things? I think it will in the general public for people who are awake and who want to listen. But otherwise, we need to wake more people up. And if it helps wake people up, that's wonderful. But I just, I'm skeptical that it should do something. There are so many things that should have woken people up, that should have stopped the FDA in their tracks, and it hasn't. So I'm just very, very skeptical on that front. Do you know if private K-8 schools in California are required to follow the county guidelines as far as quarantine, testing, vaccination status, etc., or can they make their own choices, decisions on these matters? So if it is a guideline, which most of these things are, if it is a guideline, so all the state level, the CDPH level things are guidelines. Those are recommendations. They don't have to be followed. If there are county orders, so it has to be an order, then it has to be followed. If it is just a guideline, it doesn't have to be followed. Who would provide abortions for the 12-year-olds without their parents' consent? Planned Parenthood. There may be others too, but Planned Parenthood for sure would. How do you initiate an appeal for a religious exemption denial? You would send a letter of appeal to whoever denied it. My employer changed our COVID test from QuickView to Binex Now. Binex Now is an Abbott, and they need an account to submit your test results. They give the option to do on your phone or computer. Which would you recommend? I prefer my computer. I don't think it matters. I would ask them if you have to document it through the portal. Some schools, for example, are saying you have to do it through the portal, but when you actually go to them and say, I don't want to put it in the portal, they allow you to submit it by paperwork. Does the titer blood testing to see if you have COVID worth getting? Is it worth getting? Right now, I don't think it will do anything for you. Is it for you to be able to say, well, I have antibodies. I know I'm not going to get COVID. Is it worth it for that? Yes. But it doesn't, I don't think taking a titer test and showing somebody that it's not going to get you anything in lieu of a vaccine. And I take somewhere like Europe that has it. So in Europe, if you are required to show proof, you're either required to show proof of testing, proof of vaccination, or proof of previous COVID positive results. And so even there, the antibody test means nothing. What is the status of, I believe, Kentucky Republican Harshberger's bill to recognize natural immunity at the national level? I don't know where that has gone. So national level bills, federal level bills, take a really long time to go through, and many, many of them do not go anywhere. So if you look at the number of bills that are introduced versus the number of bills that make it to actually being passed on a federal level, it is so small compared to, for example, California, where we have 3,000 bills every year that go through. And somewhere last year was the smallest number of bills that was signed by a governor in a really long time. And it was, I think he signed 800 and something bills, but that's 800 and something pieces of law statute that we created last year. Usually it's somewhere in the 1,500 range. What happens if the doctor is disciplined and the current doctor won't use the CareME system? Then you don't get a medical exemption. Unfortunately, it is really hard. I would say it's impossible, close to impossible, to get a medical exemption in California. One of the things, if you're in family court, I really, really heavily advise you to look at moving out of state and doing a move away. Right now in California, I have seen more move-aways granted than ever before in the California court system, because the judges understand now you have to have a good reason, you have to have a good state you're moving to, you have to have a job in that state or a reason to move to that state. And you also have to be willing to leave regardless of whether your child comes with you. If it comes to that. But move-aways are being granted much more than I have ever seen in the California court system, because California is becoming so expensive and so just not unpleasant, but there are reasons to move out of California now. If the FDA approves the COVID vaccine for 5 to 12-year-olds, it changes the EUA use. Will that also change the liability status for pharma for children with vaccine side effects or mortality? Are school boards liable for enforcing the vaccine mandates of possibly vaccine dangerous products? Is pharma not liable for damages in any case, FDA approved or EUA approved? So they are not liable. Pharmaceutical industry plus the manufacturers plus the people administering the vaccine are not liable for the vaccine if it's EUA under the PrEP Act. If it's FDA approved and there is a childhood approval of it, then it falls under the National Vaccine Injury Compensation Program for Children Compensation Program. And that's for children and adults. It has no liability. If a school forces the vaccine or if an employer forces the vaccine, the problem there is you have to show causality. So you have to be able to show that A, you were forced to get it and that there was no other option. So remember, you can always homeschool. There was no other option, and that the vaccine actually caused that injury. And that's the biggest piece, that there is no causality, and doctors are not willing to say. It's very, very rare that a doctor will say, yes, the vaccine caused that to happen. And so there has to be harm done first before there's any sort of liability. And even then, I think it would be really, really hard. Do you know if they've been successful in creating vaccines in lettuces? So I don't think they have yet. Tobacco plants are the other one that I think they're starting on. I think those types of vaccines that are being created that are in food and things like that, I do think the FDA will be more skeptical of and require them to actually go through clinical trials before they, full clinical trials before they approve them. I think there'll be a lot more pushback on those. I think the more they push on those types of things, the more people actually do wake up and are concerned with the lettuce they're eating at McDonald's and what it has in it. How can we define a personal exemption? So as personal belief exemption, you don't have to define it. You don't have to explain it, because it's just your personal belief. It doesn't matter what the it can be any explanation, but you don't have to explain your personal beliefs. You can just say it's against my personal beliefs. Certain government childcare programs, such as CalWORKs, require CDC schedule of vaccinations. So yes, CalWORKs does, but there is an exemption. There's a form. If you need this, email me, because there's a form, but you can look up, there's a form that you can sign. I don't remember the name of it. We went through this a few years back. There was a bill to make it more stringently required, but there is a form that you can complete. You have to ask for it. They don't offer it freely. That I think it's even a personal belief exemption form. It's not a religious exemption form, but it definitely, you can get out of CalWORKs. You don't have to, the vaccines are not required for CalWORKs. There is an exemption there. You do have to ask your CalWORKs person, your liaison, whoever it is, for it. But there is a statement that you can, and they just ask for it, and they have to give it to you. So somebody asked to repeat who you submit your complaints to if your religious exemption is refused. You submit a complaint to the EEOC, which is the Employment Equal Opportunity Commission, and the in California, you submit it to the Fair Employment and Housing Department. In other states, you want to find your employment person who is there for employment discrimination in your state. They're different entities. If my child is already in high school, will they have to get the HPV shot if that law passes, or is it only for incoming freshmen? It's not clear. We don't know how the language will be worded. So it may be either one. So somebody asked about the positive. So for the NCAA, how can you show that you're positive? Will an at-home test work? So I don't think an at-home test. So if you have an at-home test that is positive, you're likely going to be asked to do a PCR test regardless. You're likely to be asked to do a PCR test that will show that you are truly positive. The at-home tests have a much higher rate of false positives, and so they're not seen as sort of the gold standard. And so if you do test positive on one of those, I'm going to guess that they wouldn't use that as the answer, and they would tell you to go get a PCR test to verify it. Anything you like to call out about Dr. Fauci and the CDC director today? There's so much that I could call out on them. They're in bed with pharmaceutical companies. Let's just put it that way. They are so compromised and corrupt that, I mean, my answer to people that question that is go look at the money. Go look at the amount of money that Anthony Fauci has made over the years in the position he's in, from HIV and AIDS and from this COVID mess. And Dr. Walensky is, she's a mouthpiece for all of it. So, and I would say she's compromised too. I would also go look at Anthony Fauci's wife for a bit, and what she's doing and where she's at. And it just, once you start going down that rabbit hole, there's just so much that you can question and realize how corrupt the whole system is. You know anything about the T-Detect test that tests for T cells? So I actually did the T-Detect test and it came back negative, but I did it really, really early on. So one of the key things is the T-Detect test is the only test that's out there to test T cells, and it's EUA authorized. So I think they were in a learning process. So I don't know currently, how good it is and what their success rate is, but I think, and I look forward to more companies coming on the market with similar products, so that there is more competition and they're doing better. They're really trying to make the best product possible. Today on the Gary Null Show, and referencing Veritas documentation that involved DARPA, was exposed, showing conclusively that Fauci knew that several meds, including ivermectin, work to prevent COVID. Therefore, should the emergency status be removed? As I said, there is so much corruption and so much mess in all of this that I don't trust the government to do anything right, especially for their own people. So I think we have to wait and see. I mean, so many people knew that ivermectin worked. I mean, in India, they were handing it out. In different countries, they were handing it out as the treatment, and rates dropped and people survived. But even without ivermectin, you have to realize the amount of people that died in the United States from COVID specifically, not with COVID, but from COVID specifically. If you look at them, they have comorbidities. It's not the ivermectin that's going to save them. It's their health that's going to save them. If you're obese, if you have diabetes, if you have heart condition, if you have anything else, like choose whatever comorbidities, high cholesterol, whatever it is. I mean, look at the health of our country. To me, it's not surprising that America is dying from COVID. We're dying from everything else. COVID just happened to speed it along. In your opinion, what country outside of the US would be safe to move to, where vaccines and mandates, etc., are not a threat? It's a really hard question. I thought about this because I grew up in England and I have family in Europe. I would not go to Europe. I would not go to England. I would not go to New Zealand. I would not go to Australia. I would not go to South Africa, which are countries I consider, I mean, I speak English, I speak other languages, but, I think of those countries as places that I would have gone. Actually, South America is probably where if I had to move out of America and I was looking for somewhere specifically to be more safe from a mandate perspective, and I haven't looked a lot at South America, but South America is somewhere I would look into. I don't know whether it's the answer, but I do think there are places, at least pockets in South America, that I would look into. I mean, even places like Mexico. Those countries have other issues, but I think there are countries that I would look at in Central and South America. But I'm not talking out of knowledge there. I'm talking out of where would I consider. I mean, at this point, Russia looks pretty good from certain perspectives of mandates and things like that. Would not go to China either. Okay. If the school keeps asking us to register and submit results of an at-home test to iHealth, can they actually require it? Is there a good way to politely refuse? So I think you can question it. I think the schools have a right to, they have the ability to require it. My question for them is, if you say, I really don't want to use the online portal, is there any way that I can just show you, take a picture of it and send it to you and have you share it, have you do the checkbox? Now, does that prevent them from going in and uploading it to your account without you knowing? Yes. I mean, they could do that. So you run that risk, but I would see if there's a way that you could just hand it to them, paper copy kind of thing. Do you think private Catholic schools will be able to uphold the PBEs they claim they will honor if CA removes them? Do religious schools have the ability to uphold these? No, if the law says that all private and public schools have to follow the mandate, they have to follow the mandate. And I believe, I've had conversations with the Catholic Conference, and they will follow the law. They will not go against the law. I think the same is true. I think there may be some schools that don't, but the question is, what are the ramifications if those schools don't follow the law? They're breaking the law. And so there will be ramifications for that. What those are, they're not written anywhere. So you answered the question about the hepatitis B vaccine for 7th grade versus 9th grade. Is there any rhyme or reason on why 7th graders were given a pass? Why not require 7th, but then require in 9th? I don't know the history of that and why 7th graders. I think what it was my guess is, and I don't know this for sure, but my guess is that when the hepatitis B vaccine was added to the requirements for school, so we didn't always have 10 vaccines on that list. The last one to be added was the varicella vaccine. Before that, it was the hepatitis B vaccine. So when this started in the 1960s, I'm pretty sure the MMR was on there, polio was on there, and probably the DTP, which is diphtheria, tetanus, and pertussis. I don't know, the Hib wasn't on there. Anyway, so when the hepatitis B vaccine was added, there was a kindergarten checkpoint and a 7th grade checkpoint. And my guess is that when the hepatitis B vaccine was added, that they said, okay, we're adding it that you have to get it in kindergarten, new entries for kindergarten, but that you don't have to have it for 7th grade for that checkpoint. The issue there is that checkpoint, they considered that to be the checkpoint. And so once you get past the checkpoint, you're not checking anymore. It used to be pre-2015, your vaccines were checked at kindergarten and your vaccines were checked at 7th grade. And they weren't checked in between that, and they weren't checked after that. High schools never checked for vaccines prior to 2015. 2015, I think. Some high schools may have, but it wasn't common practice because it assumed that if you got past 7th grade with whatever you had, you were good to go. And so my guess is that it was put in there saying that it wasn't required for 7th grade, meaning it wasn't required for the 7th grade checkpoint, but that became obsolete because they're now checking, or it wasn't fully, what they should have put in is it's not required at the 7th grade checkpoint. It doesn't need to be it doesn't need to be checked beyond that. Has a person that has been exposed to Omicron test positive for COVID? If so, would that show on a titer? It should, but titer tests aren't completely 100%. So if you've got symptoms, then most likely you will show positive on a titer test. If you don't have symptoms, then there's, some people get vaccinated and don't have a reaction to the vaccine and don't show titer tests for it. Any recommendations for lab that run PCR tests on 30 or fewer cycles? No. A 35, 37 is the lowest that I found for PCR tests at labs. I will say, for example, UCLA does a test that is a saliva test that is called SwabSec. And while they run a PCR test for part of it, the second part of it specifically sequences for COVID. And so to me, that sequencing test is better than a PCR test. Okay. I thought the test you're referring to at UCLA is only for students and staff. Is that correct? It is correct, but other places can use that technology. So for example, if you are at a different university or at a school, you can ask to have that technology used. For example, the LAUSD school district, I believe, is using that. Critical. Okay. Somebody just asked the last question, which is what I usually say at the end, and that is, what can you do and can you make donations? So I do ask, if you appreciate the work we're doing, that you make a donation to a Voice for Choice Advocacy. We are based solely off donations, and I don't take any money from a Voice for Choice Advocacy. If anything, I give a lot of money to our organization, but we just hired 4 different people, and they are we need to fund them. So I'm going to put the donate link into the chat, and if you can make a donation, it's not expected, it's not required, but it is much appreciated if you do. So thank you so much, and good night, everyone, and I will talk to you soon. Thank you. Bye-bye.